Okay, guys, another fan question for the day is what do chiropractors do, right? The biggest misconception is that chiropractors only work on backs or spines. And, I could see where that kind of comes into play is, back pain is the number one leading cause for hospital visits, for ER visits, for chiropractic visits. So it's easy to associate back pain with chiropractors. But the reality is that we work on everything, anything musculoskeletal related. And those that could be muscles, joints, ligaments, tendons, any of those things apply to what we do. It's not just working on the bones and the joints itself. It's working with all of the supporting structures and muscles as well. So, when you talk about tendon, it could be tendonitis in the elbows, tendonitis in the shoulders, the hips, whatever, bursitis, and then the muscles as well, whether it's a muscle strain, a muscle spasm, massage therapy as well. If a chiropractor doesn't have a massage therapist on staff, he knows various forms, or he or she knows various forms of massage therapy, different techniques that will help to kind of release that trigger point, various types of massage to release that trigger point in conjunction with the adjustment. You gotta realize that the muscles in all of the connected, soft tissue, they connect to the bones, right? So if a bone or a joint is affected, well, consequently, there's going to be a muscle or tendon associated with that problem. So if I have a joint here, right, that has muscles attaching in all different angles, and this joint is offset like that, then obviously the muscles are going to be affected on one side or the other. Same thing with the spine. If you take the spine and you stack it up here, and you have muscles coming in at different, on the different sides, and let's just say you have a fall or an accident or some kind of trauma that causes the vertebrae to shift, or in a chronic condition with like scoliosis, if the spine's bending this way, right? So the muscles on this side are going to shrink, right? And then the muscles that attach to the spine on this side, they're going to be elongated. So those muscles have now become affected. So you need to be working with all of the areas that make that problem, if you will. We don't just work on joints or low backs. It's collectively the whole musculoskeletal system, if you will. So I hope that helps answer the question. What can we help with, and things like that. A couple other odd things that a lot of people don't think that we can help with. TMJ, that is probably one of the problems that people have that go kind of they don't get many answers or don't get much help with. A dentist kind of is usually unsure what to do. They might suggest a night guard or something like that, but you're kind of left searching for, what do I do now? But chiropractic is amazing for TMJ. You can adjust the joints in here. You could be working on the muscles inside the mouth, outside the mouth, and along the neck where everything kind of comes together there. So that's a good one. Another one is plantar fasciitis, which is an inflammatory pain that happens on the bottom of the foot, affects many people. And most of the time when I get somebody in here that has had plantar fasciitis, they've been dealing with it for several months because they've gone on to different types of doctors or tried different types of things, and nothing's worked. There's specific techniques that we use, not only adjusting the feet and the ankle bones, but working with the soft tissue on the bottom of the foot to get rid of that inflammation and ultimately correct that plantar fasciitis. Golfer's elbow, tennis elbow, wrist, carpal tunnel. Carpal tunnel is just a little tunnel where there's nerves that go through the tunnel in between the wrist bones, and those get impinged and cause that numbness, tingling, burning sensation in the hands. So you can adjust the wrist bones to open up that space for that tunnel, allow that nerve to flow freely, and get rid of that pain, that impingement, and that's creating that pain in the hand. So hope that answers the question. A couple other things that we help with. Again, feel free to ask questions, email us, direct message us, and we'll get those questions answered. Talk to you soon.